Joining us now is Representative Renee Ellmers, member of the House of Committee on Energy and Commerce. Thank you for being with us.
Well, thank you for having me, and I'm so happy to have the opportunity to talk about, these recent numbers that have come out on the issue, because the American people need to understand the results of what Obamacare is doing. I mean, you pointed out such a great point about the cost that is increasing for women, older women across this country. The Obama administration and the Democrats talk about a war on women all the time. What bigger war on women could there be than this?
Well, and you point this out, and Renee, we should cite your resume. Now a member of Congress, you are well acquainted with health care, and that's not an embellishment. You're trained as a nurse. You moved to North Carolina to help with a medical practice in Dunn. Forgive the play on words, Dunn, D-U-N-N, North Carolina, but
right.
But this whole notion of these outrageous premium hikes for women over the age of 50, it sounds like, gosh, they would be done, D-O-N-E, under Obamacare.
Well, and the thing of it is women that age are the largest receivers of health care in the country when you think about it, because, most of the health care that is obtained is in your later years. I mean, you obviously know how as life is starting to slow down, or you're trying to make things work in life, you're going to the doctor more. So these women, the women that we're talking about here that fit into this age group, 55 to 64, pre-Medicare coverage, are now having to pay astronomical amounts of money just for their health care. And, wasn't the claim that, that from our president that the cost for the average family was going to go down $2,500 a year? Now what this is showing are those ladies, these women that are so important to all of us, who make the health care decisions for our families, who take care of our families, they're the caregivers for all. They're the ones who are seeing the greatest increase, and that's why we're working so hard on the Energy and Commerce Committee to make sure the American people understand there are alternatives to Obamacare that will be cost-saving.
And let's go back to this, Renee. Specifically for these women, older women under Obamacare, what, in your opinion, has caused this hike?
Well, when you look at what coverage has to be obtained, there are 10 essential health benefits, according to Obamacare, that every American now is responsible for. And for these women, you're talking about women who are post-childbearing years, and they're having to carry coverage to take care of pediatric care. They're having to take care of maternal care. These women should not have to take on those costs. They've been there. They've done that. They've taken care of that and been responsible for their health care in their earlier years. Now they should be looking to the end of, when they're older and needing and requiring the health care that should be available to them at that point. It gets back to the same continuous lies that the president gave us about what Obamacare was. You can keep your doctor, you can keep your health care plan, you can keep your hospital. All of these things are not true, and the cost is going up astronomically.
Renee, years ago, Sarah Palin warned of the death panels. People said that was an exaggeration, but when you take a look at really what is happening here, and it's no accident that we're talking about women over 50, at least my perspective is you couple what is happening here in terms of cost increase and really spreading insurance costs to those who are past a certain age, with also perhaps, for lack of a better term, a state-sponsored triage. With your medical background, I'm interested in your opinion. Was it just coincidence that certain healthcare groups stepped up to say, this testing for breast cancer or this testing for cervical cancer, if you're over a certain age, we can step back, we can have fewer tests? It seems to me, as an interested observer, that the timing of that coinciding with the rollout of Obamacare was more than purely coincidental.
Well, and this is the trend, and this is what we've heard from the administration all along, that, oh, no, we're not talking about death panels here. And yet the federal government, CMS, whether we're talking about in Medicare with continuous you know, cuts and looking at changing rules and how Medicare covers our senior women, or whether we're talking about this age group of you know, over 50 to pre-Medicare. You know, you're looking at them having their networks limited, so they're having to try to find physicians, find good health care. So we're cutting back on health care access, and by doing so, we're creating that same situation. So no, is there, you know, does a panel exist right now that are making these decisions? No, but what we have is HHS and you know, our whole government healthcare system that's arbitrarily appointing rules and changes and premium increases for our insurance companies that cannot be avoided because of the increased cost of Obamacare.
Now, Renee, costs for some of these people have already increased at least 40% this year. Reports have indicated they're going to continue to climb next year. So in your opinion overall, how does the future look for older women?
And Renee, we should point out we have less than a minute to answer this.
Okay, well what I will say is this. The American people need to understand, especially women in this country, there are alternatives to Obamacare. And yes, when those 2015 numbers come out for premiums, you are going to see them increased, and we'll be learning that as it gets closer to the end of the year, hopefully pre-election, so that the American people can stand up and say, you know what, we reject Obamacare, we're ready for Republican alternatives, and the Energy and Commerce Committee is working very hard on that.
Congresswoman Renee Ellmers back home in her district in North Carolina. We thank you for making time for us, and we look forward to our next visit with you, Renee.
Thank you so much, JD, and thank you, Francesca.
Thank you.
And we want to hear from you. The war on women, is it really being exercised through Obamacare? Tweet us at Newsmax TV, #AmericasForum.